Hello and welcome. Today we're diving into a rare and fascinating condition called paraneoplastic retinopathy. This is an eye disease linked to cancer elsewhere in the body, and understanding it is crucial for both early detection and improved patient outcomes. The root cause of paraneoplastic retinopathy, or PNR, lies in the body's own immune response to cancer. When cancer cells develop, particularly in the lungs, breast, or certain blood cancers, the immune system sometimes mistakenly targets healthy retinal cells. This misdirected immune response is triggered by the tumor producing antigens that are similar to those found in the retina. The body produces antibodies to fight the tumor, but these antibodies also attack the retina, leading to visual dysfunction. Let's break down what happens at the cellular level. When the tumor triggers this autoimmune response, antibodies bind to specific proteins in the retina, disrupting their normal function. In some cases, these antibodies target photoreceptors, the light-sensing cells responsible for vision, leading to photoreceptor dysfunction or even cell death. Other antibodies may target bipolar cells, which transmit signals from photoreceptors to ganglion cells, further disrupting visual processing. This immune-mediated damage can affect various layers of the retina, resulting in a wide range of visual symptoms. Paraneoplastic retinopathy is a relatively rare condition. Precise epidemiological data is limited because PNR often goes undiagnosed or misdiagnosed. It's most commonly seen in adults, typically those who are also being evaluated or treated for cancer. The incidence of PNR varies depending on the type and stage of the underlying cancer. However, it is essential to remember that PNR is much less common than other retinal diseases, and its diagnosis requires careful consideration of the patient's medical history and clinical findings. The signs and symptoms of PNR can be varied and often subtle at first. Common symptoms include progressive vision loss, difficulty with night vision, also known as nyctalopia, sensitivity to light or photophobia, flickering or shimmering lights in the vision, known as scintillations, and changes in color perception. These visual disturbances can significantly impact daily activities, making tasks like reading, driving, or recognizing faces challenging. It's important to note that the symptoms can sometimes precede the diagnosis of the underlying cancer, making early recognition crucial. Diagnosing PNR can be challenging and requires a comprehensive approach. The first step involves a thorough eye examination, including visual acuity testing, visual field testing, and dilated fundus examination to assess the retina. Electrodenography, or ERG, is a key diagnostic tool that measures the electrical activity of the retina and can reveal characteristic abnormalities. Blood tests are also essential to detect the presence of specific anti-retinal antibodies. These antibodies, such as anti-recoverin or anti-inulus antibodies, are often found in patients with PNR. Furthermore, imaging studies like chest X-rays or CT scans may be necessary to identify the underlying cancer. While there aren't strict classifications of PNR, it is sometimes categorized based on the specific retinal cells targeted by the immune system. For example, cancer-associated retinopathy, or CAR, primarily affects photoreceptors. Melanoma-associated retinopathy, or MAR, is another subtype linked to melanoma and often presents with distinct visual symptoms. The primary goal of treatment for PNR is to manage the underlying cancer. Effective cancer treatment can sometimes lead to improvement or stabilization of visual symptoms. Immunosuppressive therapies, such as corticosteroids, intravenous immunoglobulin, or other immunomodulatory agents, are often used to suppress the autoimmune response and reduce inflammation in the retina. In some cases, plasmapheresis, a procedure to remove antibodies from the blood, may be considered. The specific treatment approach depends on the individual patient, the severity of the PNR, and the type and stage of the underlying cancer. Early intervention is crucial to minimize irreversible retinal damage. Currently, there are no proven methods to directly prevent paraneoplastic retinopathy. The best approach is to focus on early detection and treatment of the underlying cancer. Regular medical check-ups and cancer screening tests are essential, especially for individuals with a family history of cancer or those at high risk. Prompt evaluation of any new or unusual visual symptoms is also crucial, particularly in individuals with a known cancer diagnosis or a suspicion of cancer. The prognosis for patients with PNR varies depending on several factors, including the type and stage of the underlying cancer, the severity of retinal damage, and the response to treatment. In some cases, successful cancer treatment and immunosuppression can lead to stabilization or even improvement of vision. However, in others, retinal damage may be irreversible, resulting in permanent vision loss. Ongoing research is focused on identifying new biomarkers for early diagnosis and developing more effective therapies to target the autoimmune response and protect the retina. Emerging research areas include the use of targeted therapies to selectively suppress the immune cells that attack the retina, as well as the development of retinal protective agents to prevent further damage. The field is continually evolving, offering hope for improved outcomes for patients with this challenging condition.